Communication is the key to understanding and meeting the needs of others. In most situations, communicating with older adults is the same as with adults of any age. When communicating with older adults, it is important to respect and build upon the wisdom they've developed over a lifetime of experience and growth. First, establish attention by using a combination of touch, voice, and eye contact. Maintain appropriate physical closeness or distance where you sense the older adult is best able to attend and feel comfortable. Adjust volume and tone of your voice so you can best be understood. Be aware of how hearing, vision, or other sensory problems may also affect communication.
One of the issues that I want to bring up about sensory deprivation that's important is hearing loss. When you have almond trees, which is gray hair or white hair like mine, people automatically raise their voices. Some of my student nurses used to go in the room and they would see the gray hair and they automatically raise their voices, and I would drag them out in the hall. We would have a little mini in-service. You don't assume that they have loss of hearing. You check it out. You ask them, can you hear me? And then when you do, you check, is one ear better than the other?
In mental health, where I work, and otherwise too, it's a lot of touch they need. So we give them touch a lot through the, giving them a hug or touching them, okay, come on, you hold my hand and I'll take you around, take you walk, on those kind of things. And for eyesight, hearing aid, just we kind of tell that that person needs hearing aid or something. For eyesight, if they want to work on some project or something they want to do, which like even reading, so we have adaptive equipments. We suggest that, and some we keep it, and some we suggest for the family when they go home too, that they can use these adaptive equipment so that that person feels a little bit more independent in working whatever they want to do, even leisure time or fun time or their own benefit or what.
Remember that 90% of communication is nonverbal. Mirror the older adult's posture. Stand or sit at the same level. Remember, you are probably the one with the greatest flexibility. Adjust your physical placement or closeness, voice tone, and speed in order to best communicate with the older adult. Look and listen for feedback from the older adult to know if you're being understood. Anne is helping demonstrate communication techniques in a follow-up interview as she recovers from clinical depression.
What do you remember best about your mother?
Well, that she was a lady and very beautiful. And of course, I was not beautiful, but she loved me anyway.
Mm-hmm. You weren't beautiful.
No.
What makes you say that?
Well, I had a big nose, you see. And I was very tiny, and I had this little white face and this big nose. And these two teeth were the only ones that came in for a long time. And I had long curls that hung down like this. And I hate to say it, but I rather resembled Bugs Bunny.
So that's the way you felt as a girl?
Yes.
You felt that you resembled Bugs Bunny, and that you
Yes.
didn't like the image of yourself.
And the worst part about it is that I'm the youngest of 8 children, you see, and all of my sisters were beautiful in one way or another. And I wasn't, and the only thing I could say to them, well, maybe you are more beautiful than I, but I'm younger than you.
So,
And now especially that they're up in their 80s and 90s, and I'm only 39.
so you felt good because you were younger than they were.
Yes.
Now, how do you feel about your image now at your age?
Well, I think I've gotten better looking as I've gotten older. And, when you get older, things that mattered terribly to you when you were young don't seem to matter so much when you've reached, as the French say, that certain age.
The use of empathy requires a conscious effort to understand what it feels like to be the other individual, while yet avoiding having sympathy or taking on the burden of another's issues. This empathy is conveyed using active listening skills, including attentive facial expression and eye contact, open and receptive posture, nodding and verbal acknowledgments of the communication, paraphrasing or repeating the content and emotions of what is being said in the listener's own words, summarization of material covered in order to gain further clarification or move towards closure of the interview or movement to another topic. When using empathy and active listening skills, the listener must not let their own discomfort with emotional expression interfere with the interview. It is important to freely accept the older adult's feelings and recognize that they are in fact healing as they express such emotions as hurt, anger, and fear while you actively listen.
I'm feeling very grateful that we finally reached a point in our attitudes that we welcome the crying of men. I have a next door neighbor who has just lost his wife, and he cries freely around us, and it's terribly important that he do so, and he's encouraged to do this. And I'm remembering, just on a personal note, when how important that crying can be, how therapeutic that can be. My father had died, and I was very close to him. I remember just kind of aching and feeling so sick, and not knowing what it was. This was months later, and I remember thinking about music, and he always liked Franz Lehar, and I turned down the Franz Lehar record that he and I listened to together, and it was just buckets. But that good feeling that comes from all those tears, we've got to push that. It's okay.
One of the skills that we're deficient in our society, I think, is listening. When somebody's going through anticipatory grief or in the process of death and dying, most oftentimes we don't have to say I'm sorry. We can't fix it. We can just listen.
It is also extremely important to remember societal and cultural attitudes towards the treatment of mental health problems.
One of the best indicators of public and even familial reaction to mental illness, and of course I'm thinking mainly of dementia and depression, is the reluctance to come for help, to look at an adult day program as a way to get respite. There's a lot of shame there. There's a lot of denial out there. It's embarrassing. What will the neighbors think? We fight this all the time.
It's very important to respect the beliefs of people with regards to who they believe can help them when they need help, whether it has to do with mental illness, physical illness, dementia. In the American Indian culture, there's a number of different types of healers, medicine men and women being the predominant healers who are also spiritual leaders. And it's very possible if people would like to have a medicine man or woman come and help them with whatever problem they're presenting, it's very possible for these people to be brought into the Western medical system, into a nursing home or long-term care facility, hospital, to provide the services that will be comforting and healing to an American Indian person.
In the hospital environment, obviously we have rules, and then we have rules about rules, and we have more rules. And so occasionally when we have, for example, Native American patients in who would really benefit from having their medicine man come, and for example, I'll think of a ritual of using tobacco. For us, obviously, we have rules about that. And so it's been real important to be flexible to meet the needs of those individual patients and break some rules now and then. And it's been real helpful. The one thing I want to add to that is, though, the tremendous need there is in our primary white culture here to do sensitivity training with your employees and with staff so that people are exposed to other cultures, because we end up having such a narrow view of the world. And we tend to look at those people that we take care of as being very much like us, when they may be very, very different from us. And so it's really wise to do some sensitivity training and help your people look outside of themselves and to grow in that way.
Dale, acting as an individual with a history of paranoid delusions that worsen when he is not taking medications, is being interviewed in a demonstration of communication techniques.
Well, I'm glad that you came in so we could talk a little bit today about how you're doing.
Well, I guess I'm doing well. Things are a little different.
Things are different.
I think so.
Good. What's different for you?
Well, I've been feeling better. I'm getting, my wife, says I'm doing better.
You look very good.
Well, I try to look good.
But your eyes look bright, and there's a lot of color in your face. And you say that you're feeling better.
I think I am. There are times, you know, there are times when things change.
What kinds of things happen then?
Well, you know, sometimes I still have some of the sensations. Not as bad. Not like it was. You know, and but occasionally, you know, there'll be times, maybe when I get tired, or maybe when the medicine's not working well or wearing off. There might be times.
So you think the medicine that the psychiatrist prescribed is helping you?
It appears to be, yes.
Good, good. And you feel better?
Yes.
What kinds of things are making you think that you feel better?
Well, I'm getting, you know, doing things, you know, I used to do it that I hadn't done for a while, and getting out more, and you know, for the most part, enjoying myself. There are times.
So you're having more joy in your life. You're doing more of the things that you used to do. And
Yes, I have, you know, some of the things I used to do, I'm doing again.
What's one of those things?
Well, I enjoy cooking. Cooking different kinds of food, and my wife enjoys that I cook.
Well, great. I like to cook too, so I can relate to that.
Great.
In addition to the empathy and listening skills discussed earlier, this interview also demonstrates effective use of clarification skills. Clarification skills include a combination of open and closed-ended questions to assess or intervene with specific problems or issues. Generally, it is best to start out with open-ended questions that require and result in more than a yes or a no answer. If doing so results in too little or too much information, it is then best to move into the use of closed-ended questions that result in the collection of specific information. Clarification techniques are crucial when determining health and safety issues of older adults. One specific area of safety is when an older adult is having suicidal thoughts.
As an ombudsman, I frequently get calls from home care agencies who are providing services to adults in the community. And at some point in time, an adult decides, I don't want these services anymore. And the living standards, which we all value, we all have our own value systems as to how we should live, and we'd like to see everybody live well. That value system begins to interfere, and we would like to take over that person's life and say, no, we're going to improve your life, and why are you refusing services? You're not eating the Meals on Wheels that come to you every day. Your diabetes is out of control. And frequently it can be a way of wanting to end life, a passive way of suicide. Another example is adults who are living in a situation that is not highly desirable and who go to a hospital for, let's say, regulation of diabetes or medication. And they really, in their best interest, shouldn't be going home. And the response from that person is that is my home. I raised my children there. I was married to my husband and we lived there for 50 years. I'm going to die there. And that is my right to do that.
With the crisis service at the hospital, it's been interesting to me to watch after each time there's media attention given, whether it's TV or other print media, in terms of a suicide. Often after that, we'll have elderly callers on the crisis phone. And we had a lady call who was wanting to know how to find Dr. Kevorkian because she had lost her husband. She was rambling around in a house all alone. Her children were grown and had moved away, and she was thinking that rationally she wanted to end her life. This was somebody who, interestingly enough, came in and was seen by both a therapist and started on some medications. And really what she had certainly was her loss, but also she had a depression. And it was very treatable in her case. And the outcome was great, you know, for her. But it does bring up all those issues about For folks that maybe wouldn't have such a positive outcome as she did with the medication and therapy, is there a point where rational suicide is a choice that they can make? And it's an interesting point for our society to wrestle with. It's very important that when we have individuals who are suicidal, that we do excellent suicide assessments and that we really look at them clinically in terms of what we can do for them. It's so important with suicide assessment, especially with the elderly, to look at their losses. What are the anniversary dates that they're going through? What's happened in their world recently? And that we do those things that we can to have positive outcomes with these individuals.
It is often helpful to incorporate reminiscence and life review approaches with active listening skills, as in this group setting.
I have a canning jar.
I know them things too. You have to have a rubber band on here.
It's missing the rubber band.
You have, yeah, underneath this.
I have a really old canning jar. Are these the one? Did you ever use one like this?
Yes. That's all we had at first.
That's all you
In fact, we like those better than these.
Which are older, these or those?
Those, I think. I don't know. I couldn't say for sure.
Did you ever have one like
Oh,
these?
yes, we had like them all the time.
We can't like.
But you used to use the ball.
A ball.
The ball, that was the name
This
of
is
the
a
jar.
The jar.
Oh, the name of the jar. Okay.
This doesn't say ball on it, but it has the
That's a mayonnaise jar, I think.
it has the
Yeah, that's
porcelain
what
on
they
the
have.
inside, which helped me.
used to use too.
You use this kind?
We used every kind there was.
What did you can?
Oh, we didn't do corn, but we made a lot of stuff, like pickles and green beans, and I think we got the other part of the green beans that they didn't buy up here. I think this place is about half of the green beans in Minnesota.
They serve green beans a lot.
Yeah, so, and we must have the other half.
A lot of times when people are grieving, they'll shuttle back to remembering earlier times and start to reminisce. And what I've discovered that when people start to shuttle back and forth from the present to the past, what they're doing is accessing times when they've experienced other transitions and are rediscovering and re-accessing the confidence that they had to face present and future losses. Reminiscing is also a way of re-grounding themselves, of really finding that solid point from which they can proceed and face the future.
Some additional communication strategies include making sure you have the attention of the older adult when changing topics. Plan what you say beforehand so you can present yourself clearly and understandably. Consider breaking information into smaller segments to be introduced and discussed one at a time. Be practical in your approach.
To me, you treat people like you want to be treated. And I would, even it was her house and I was doing the work there, I always asked her, could I do things for her? And like she'd always was one for a lot of company. And I would invite them to come in. I didn't want her to stop doing from what she was used to all the time. And I, would invite them into the house and her company, let them come in. And because a lot of people didn't want to do that because it was extra work. But I figured that they didn't have very much. She didn't have very much to look forward to because she couldn't get out that much. And then I would try to make it as comfortable to her of her doing the things that she was doing before she got sick. And that's the way I tried.
And I remember working at Northwood Children's Home when our consultant there, Dr. Stan Shapiro, used to say, surprise the heck out of them. When they're being negative, maybe what they really want is attention. And so we were giving hugs to all these obnoxious little kids. I'm sounding light, but I really mean surprise interventions can sometimes do it. I think it's important in working with staff, particularly new staff and volunteers, to let them know that the the negative person, perhaps the depressed person, perhaps the angry person, doesn't usually respond to your efforts to bring them up. Rather, they bring you down, disqualifying people who are trying to help them, negating ideas of activities that might be fun for them, a general putting down or ridiculing of others. These are anger-producing behaviors, and it's important from a job effectiveness point of view and a survival point of view to recognize that avoidance of this type of individual, at least for short periods, is perfectly okay. And it holds true in families as well. If somebody's negative and destructive, get some space, because you usually don't change these people.
This program has emphasized that communication with oriented older adults takes the same form as with adults of any age, with the exception of adjusting for any hearing, visual, or other sensory changes. Techniques of empathy, active verbal and nonverbal listening skills, paraphrasing, summarization, and clarification skills have been discussed and demonstrated.